So, team brief. Hi, I'm JP surgeon.
Vanessa, anaesthetist.
Our case, Anish Patel, is a 46-year-old man who's got a laryngeal tumour.
It's a big tumour that's arising from the epiglottis. It's going up to about the level of his uvula, so it's big.
It's going to be a difficult awake fibre optic intubation, so that's the most complicated part.
So I'm going to need to work my way around it with the fibre optic scope. If there's an emergency, then it'll be tracheostomy.
Anish Patel is a dentist married with 3 young children. 18 months ago, he realised something was wrong.
I've been having a few breathing difficulties. The throat is quite narrow. You're selectively choosing what food to eat. There are times where I've been waking up in the night, gasping for air, and fearing that I might not even wake up the following morning.
This is the growth here. This white, this shouldn't be here, this round thing, probably the size of a small tomato or the size of a small satsuma in the windpipe. So this little black slit is what he's breathing through. So I would say his airway is reduced by 90%.
I think I'm one of these people that don't share my emotions and I don't really talk about it, so I don't think I've shared it with anybody really, even my wife, because I don't want people to worry. And I think it does burden in you. You do think negative thoughts at the back of your mind, so I thought, is it some sort of tumour in my lungs or something like that? It's just going round and round in your head, and it drains you, it really does drain you.
These patients are coming in at a very emotional and critical time of their lives. They're coming in for what is often life-changing surgery. Feeling all right? It's such a privilege to be able to nurse them at their kind of lowest moments. I'll take that back up and pop it in your room for you.
So fighting for your breath is probably one of the most frightening things that you could ever have. And so that's why every day in the morning he feels really tired, because he's denying his brain from oxygen.
And is this a good breathing position for you?
Yeah.
Generally?
Yeah.
Okay.
For anaesthetist Vanessa, it's a difficult process putting Anish to sleep.
That's the tumour, that's the epiglottis. And that's a big tumour, and it's sitting like a big ball. The laryngeal inlet should be exactly where that tumour is, and it's not.
The tumour is blocking almost all of Anish's airway. Vanessa will need to find a way of inserting a breathing tube into the trachea by the side of the tumour. If she can't, then the team will have to make an incision in Anish's throat.
So what I want you to do is press this to sniff. Okay, you ready? Ready to sniff? 1, 2, 3, sniff, sniff, sniff.
After 40 minutes, Vanessa successfully inserts the breathing tube around the tumour.
So I tried with the fibre optic scope, but I couldn't see exactly where the tumour was arising or where the way in was. And eventually I used a combination of the fibre scope and a different scope, and it came into, the hole came into view, and we got in there. So ready, steady, slide. So yes, that was really tricky. Anyway, that's good, we like a challenge. The plan B was getting closer, but not there.
Surgeon JP knows that when operating on the throat, every decision counts.
We're operating on a vital organ. It's like operating on the heart or on the brain. The windpipe or larynx is a vital organ. You can't live without it, and this tumour is blocking that. So what we have to be is aware of the consequences of how your operation is going to affect his breathing.
The first part of the operation is to insert a camera through the mouth to have a look at what he is facing.
This is the tumour here that I'm just starting to move, and see how this thing would block his windpipe. And he could have choked to death at any time over the last 18 months while it's been there. So I'm just grabbing hold of the tumour and just moving it around, and it seems to be arising from just the left side of the voice box. The way I'm thinking is that it's possible that we might be able to remove it today. I think we will start with the needle then, I think.
The first signs are positive. JP thinks instead of taking a biopsy, he might be able to remove the whole tumour.
This tumour is much more localised to less vital parts of the windpipe, so hopefully I should be able to remove it today. It might be possible to do that today.
JP will need to carefully cut around the tumour to to avoid causing irreversible damage to Anisha's vocal cords.
So it's really important to try and remove it with minimal side effects. Will he swell up? Will it damage his voice or throat? Just slowly dissecting the tumour off its stalk, and it might be at a point where it's possible to deliver it. Do you cut the red wire or the black wire? Here we go, we're just removing it gently from the throat. And you can see it coming out now through the camera, and this is the tumour here. So you can imagine that's quite large, that would block his windpipe.
I mean, I knew it was big, but yeah, that looks massive now that it's out. Gosh.
That was like the rabbit out of the hat, definitely. And we've got a nice clean airway. Those are the swabs I've put in there just to stop any bleeding, but the tumour's been fully removed. Great, okay, we're all done, that's brilliant, great job. Okay, let's do the sign out, please.
The surgery has taken 2 hours, with JP confident the tumour isn't cancerous.
It's benign, by the look of it, because it's smooth and round. It's not hard, it's soft, you can see. We'll send it to the laboratory to confirm it. So he'll be much better with that, removed. We have to say the important part of this was the team approach with Vanessa providing the complex intubation, which we saw took a lot of time. So we have all the skills in this hospital to do this kind of surgery very safely.
Just waking up, okay? The operation's all done. Just going through the recovery. Your throat's going to feel sore, but it's out. And it looks benign as well, so...
I bet you feel better, you can breathe already. It's completely gone, so you'll be fine. Well done, it looks fine, nothing to worry about. Definitely benign. All right, just rest. Take it easy. Yeah, I mean, it's difficult to do this kind of surgery through the mouth. It's much easier to open the neck, but then of course you're cutting into the patient's neck. The healing is more complicated. The patient would stay in hospital a week instead of a few days, and this patient will be able to go home tomorrow. So now he'll be able to breathe perfectly normally, he'll be able to speak normally, so it's changed his life.
And this current feeling, it's a feeling of a good high. My voice is sounding different already. I'm looking forward to hopefully sleeping a bit better, maybe snoring is less and letting my wife sleep a bit more, and yeah, just running around, breathing a bit more freely, and feeling less tired.
The surgery may have been a success, but Anisha's decision to delay medical intervention could have resulted in a different outcome.
Never shy away from your fears in terms of if you feel some suspicious signs and you are concerned, it's better to get it checked and be told that there isn't anything wrong than to not get checked and find out that you've got something wrong, really. I was a lucky one. Yeah.